Hi, my name is Amy and I am a nurse at Dr. Genevieve's Surgical Center. Today, I'm going to give a brief overview of what you can expect after liposuction and general postoperative instructions. Depending on your specific needs, Dr. Genevieve will prescribe medications to take at home. There will be 2 medications that need to be taken on schedule. The first medication is the pain medication. Typically, the pain medications are taken every 4 to 6 hours. Your first dose will be given at our ambulatory surgical center, and the discharging nurse will tell you what time your second dose should be taken. It is very important to maintain the schedule. If you wait until you're in pain to take the medication, it will be harder to keep pain adequately controlled. The second medication that will be taken on a schedule is your antibiotic. The first dose should be taken the night of surgery. Your antibiotic should be taken twice daily until the bottle is empty. If you have issues sleeping or with nausea, Dr. Genevieve will prescribe medications to assist you. The sleep medication should not be taken until 24 hours after your surgery. It should also be spaced out at least 2 hours from your medications. You should not operate a vehicle until you can tolerate pain without your prescribed pain medication. Recovery should not be taken lightly. Make sure your caregiver stays with you a minimum of 24 hours after your surgery. It is important to get up and walk around after your surgery, a minimum of every 2 hours. Be sure to rotate ankles and pump your feet every hour to get your blood circulating. After liposuction, you will have a moderate amount of oozing. This may look like a large amount of blood, but it is actually very watered down blood, similar to Kool-Aid. Do not be alarmed by this. It speeds up the recovery process. It is a good idea to line your bed with puppy pads and old sheets, as your dressings may become saturated while you sleep. If you notice this, you can apply maxi pads to reinforce the dressings. Your dressings will consist of these, secured by tape. The day after your surgery, you can remove the dressings and replace them with large maxi pads that look similar to these bandages. Replace them as necessary. Keep incisions covered until you're no longer oozing. You will have an abdominal binder that you need to wear. It is secured around the abdomen like this. You will be sized for a compression garment at your 1-week appointment. The garment looks like this. Your clinical coordinator will help size you and demonstrate how to properly wear your individualized garment. You may do strenuous activities such as working out or lifting if you only had liposuction, once you can tolerate it. It is usually advised to wait a week prior to exercising. Avoid alcohol, aspirin, and ibuprofen for 1 week after surgery. You will return to the office 1 week after your surgery to be assessed. If you have any questions or concerns, or if you develop a fever of over 101.5, foul odor, or a sudden increase in drainage, please call our 24-hour line at
210-270-8595.